So hello everyone and welcome back. I'm going to talk a little bit more about those patients I see that are inexperienced and or have social sexual fears and how my work helps. And one of the most fundamental reasons I feel that this type of therapy, intimacy, behavioral therapy, can be so helpful for this group of people is that this is a judgment-free zone, and they know it. And so when a person comes to see me, I do everything I can to meet them eye to eye and, give them a sense of ease right from the beginning and seek to develop a rapport, really meet them where they are and without forcing anything, and really just find out about who they are and how their experiences have led them to come to therapy and what they hope or seek to gain, really like I would with anyone. However, with this group of people, it's really so crucial to develop a sense of trust, that the more that they can open up, and it will determine how much more they'll be able to gain from especially the guided touch exercises, where they're more willing to go in and feel and experience and notice how anxiety and fears are showing up in their bodies, and then they can seek to replace them gradually. So with this group of people, it's really true for everyone that I work with, but in particular, people who are inexperienced have that much more trepidation about making intimate connections. And so if anything, the pace has to go maybe even slower than I normally would, although it's always slow, because that's the only way that we change, is gradual or shift. So I work with people in these sessions very moment to moment, and often, well, not often, actually always, I've found that if you're coming with an experience, then the obvious thing is you need some experience, right? So there's the assumption then that a lot of what we're doing in terms of the guided touch and learning about their bodies is so new that the exposure therapy part of this, or the need to reinforce it, is even more important for it to really stick. So my sessions, or my program, is 3 to 4 months, and I usually find that with this group of people, at least 4 months, once a week sessions, so that they have enough time to explore, and also so that I can add in a few sessions that other patients may not need, which are more educational, teaching a little bit more, sharing a little bit more about women, their bodies. That's where I get to play every woman, in a way. So really just having a one-to-one conversation about asking questions, or what is it, how do women work, or what do they like, what do they need? Sometimes what is so useful for people struggling with this is to really find out that they're not alone. Of course, the nature of their issue of sort of missing the boat, of course, they feel alone. They feel like, since they can't share it with anybody really, or outside of a small group maybe, that nobody will really understand, or that, of course, they must be among a small group, and that's so not true. And just like with all the other issues that I help with, but it's really, with this, it's like really coming out of the cold and into kind of a safe, warm place. And so the judgment-free zone is crucial, as I said, and the gradualism is even more crucial of the way this progresses, to make a shift and change and to learn. I find that I need to add in some exercises that those that have experience do not need, usually. So maybe 3/4 of the way through the program, into the 16 weeks, I add in some educational kind of exercises, and one of them is, how to move your body, how to move your body when you are actually having sex. So it's like a simulated role play, if you will, with clothes on or underwear, and really just moving on the floor on a mat, moving around in and out of different positions and finding out and exploring and talking it through while doing how to move in a way that's comfortable, just to get their body familiar with you moving the hips, where everything lines up, where the weight of the body is. And it's an opportunity, too, to demystify, deconstruct, let them know that what they see on TV and film and pornography is not realistic in terms of it looks so seamless, right? So even people with experience, I let them know it's inherently awkward, clumsy, messy, you get cramps, interruptions, you got to pee. I mean, so many things can happen that many people, of course, those of us that have experience take for granted in knowing and deal with, but people who don't have no idea. So often just the usefulness of being able to share with them that it's normal to encounter all kinds of problems when the bodies are commingling, and it actually can be kind of funny. Some of the things that can happen, and slipping in and out, and what do you do, and so I in a lighthearted way really try to guide them to understand certainly that they're not alone. Of course, they always feel that they are, but that this is just, sexuality is not something that you get so experienced with, or you're having sex that you don't run into these issues of the body. So that can be so useful, and is so missing from just general knowledge about how to move. So this is one of the things where all my kinesthetic, dance, everything, all these experiences I have with the physical, with the body, really help me in, movement. My ease with movement in my body help me to role play, if you will, with people in experience, to be able to, just feel more comfortable and gain some confidence, so that when they actually are with a partner, their bodies kind of remember how to move. So so I just something I discovered along the way that was really necessary to include in this therapy. So thank you so much. I'll end here for now.